removable appliances with Theramon sensors. We've been using Theramon sensors, I think, almost since the Theramon company first started producing them, and I would be lost without these sensors. They fit into removable appliances, they're embedded within the plastic of the appliances, and they measure temperature over time. So they're a completely sealed unit with a battery, with a small microprocessor and a thermometer, and then a small near-field coil, a near-field frequency coil. So it's a little bit like these no-cash credit cards, where you just place the credit card beside a reader, or the London Underground system, where you place the Oyster card beside a reader, and instantly the a message can be transferred across with near-field technology. Now this means that the Theramon chip, this little device here that's placed inside the brace, doesn't emit any frequency, any radio waves. It's completely inert, it's dumb, it's effectively dead. It's only once it's placed within a near-field reader, the near-field reader generates a field. Then you get back EMF, you get a reverse field produced, or a resonant field produced by the coil within this chip. And on the back of that signal that it sends out, you can transfer data, very similar to how radio waves work and you listen to a radio station. And that signal, that data is then read, and the information is drawn out of the microprocessor. Now, what the microprocessor does in other situations is during the day, the weeks or months between being read, the microprocessor wakes up every 20 minutes. When it wakes up, it measures the temperature. It then goes back to sleep again. By doing that, it can save its battery power and I find they last somewhere between about usually a year and a half and 2 years. Sometimes only 1 year, but that's usually unusual. And they tend to be very, very accurate. We've had a couple of failures, but not many. Frequently, because I've drilled through one of them. But they're so accurate that I can show the in-detail analysis to patients who are, when there's a disagreement between brace wear, and I'll say, okay, you got up at 8:30 this morning, didn't you? Well, you took the brace out at 8:30, and the patient will go, yes. And I go, and then you didn't wear it again till 10 o'clock this morning. I presume that's when you finished breakfast and put it back and remembered to put it back in again. And they'll go, yeah. And I go, well, that's an hour and a half. Now, that hour and a half, and then add it up to the other hour and a half in the day, that's when you're not wearing your brace so well. And by giving this graphic illustration and feedback to patients, they know you're watching, and compliance is immeasurably better. I have some stunning wear. I mean, the treatment I do requires real dedication because it requires change in an individual. So consequently, we ask for, a 20, 22 hour a day wear of our appliances, and we get it. I know we get it because I see the readings. And these children, particularly the under about 12 years old, it really switches them on. Seeing how well they wore it. So then they compete with themselves, they compete with each other. And I couldn't do that without good quality recordings, good quality measurements. And measuring is the hallmark of science.